This medication is commonly used to alleviate discomfort in the eyes such as pain, irritation, and redness after having cataract eye surgery. The active ingredient in Ilevro Suspension drops is Nepafenac, which falls under the category of nonsteroidal anti-inflammatory drugs, NSAIDs. It functions by inhibiting specific natural substances in the body called prostaglandins, which are responsible for causing pain and inflammation. The recommended dosage is 1 drop in the affected eye once daily, beginning 1 day before surgery and continuing for 14 days after surgery. It is best to administer the medication at the same time each day. When using Ilevro Suspension drops after eye surgery, it's important to follow your doctor's instructions carefully. Usually, it started 1 day before surgery and continued for 2 weeks after surgery. To apply the eye drops, wash your hands first and shake the bottle well before each dose. Avoid touching the dropper tip to prevent contamination. You should not use this medication while wearing contact lenses. Tilt your head back, look upward, and gently pull down the lower eyelid to make a pouch. Hold the dropper directly over your eye and place 1 drop into the pouch. Try not to blink and do not rub your eye. Repeat these steps for your other eye if directed. Do not rinse the dropper and replace the dropper cap after each use. If you are using another kind of eye medication, wait at least 5 minutes before applying other medications. Use eye drops before eye ointments to allow the eye drops to enter the eye. This medication is usually used for up to 14 days after eye surgery or as directed by your doctor. Do not start using this medication early, use it more often than prescribed, or continue using it for longer than directed by your doctor. And be sure to tell your doctor if your condition lasts or gets worse. When applying this medication, you may experience a temporary stinging or burning sensation in your eyes for 1 to 2 minutes. You may also notice eye redness and headache. If these effects persist or worsen, it's important to notify your doctor or pharmacist. It's important to remember that your doctor has prescribed this medication because they have determined that the benefits outweigh the potential risks of side effects. Many people using this medication do not experience serious side effects. However, you should contact your doctor immediately if you experience any serious side effects such as eye swelling or pain, excessive eye discharge, vision changes, or if you notice any symptoms of a serious allergic reaction, including rash, itching, swelling, severe dizziness, or trouble breathing. It's important to note that this is not a complete list of possible side effects, so if you experience any other effects not mentioned here, be sure to contact your doctor or pharmacist. In the US, you can report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can report side effects to Health Canada at 1-866-234-2345. Before using Ilevro Suspension drops, make sure to inform your doctor or pharmacist if you have any allergies to Nepafenac, aspirin, or other NSAIDs. This product may contain inactive ingredients that can cause allergic reactions, so it's important to discuss any allergies with your pharmacist. Inform your doctor or pharmacist about your medical history, especially if you have asthma, bleeding problems, previous eye surgery, other eye problems, diabetes, rheumatoid arthritis, or nasal polyps. After applying this medication, your vision may become temporarily blurred or unstable, so it's important to avoid activities that require clear vision until you can do them safely. If you are pregnant, use this medication only when clearly needed and discuss the risks and benefits with your doctor. It is not known if this drug passes into breast milk, so consult your doctor before breastfeeding. It's important to be aware of any potential interactions with other medications when using Ilevro Suspension drops. This includes antiplatelet medications, blood thinners, corticosteroid drugs, and other eye medications. Always keep a list of all the products you use and share it with your doctor and pharmacist. Be sure to check all prescription and non-prescription medicine labels carefully, as some medications containing pain relievers/fever reducers may increase the risk for bleeding when used with Ilevro. If you are taking low-dose aspirin for specific medical reasons, consult your doctor or pharmacist for more details on how to continue use with Ilevro. If Ilevro Suspension drops, final dose form, is swallowed, it can be harmful, and if someone has taken too much and is experiencing serious symptoms like passing out or having difficulty breathing, it's important to seek immediate medical help. In the US, you can call your local poison control center at 1-800-222-1222, and in Canada, residents can call a provincial poison control center. Remember, it's important not to share this medication with anyone else. Your doctor has prescribed it specifically for your current eye condition, and it's not intended for use with other eye conditions unless instructed by your doctor. If you need to treat a different eye condition, you may need a different medication. Always follow your doctor's guidance. If you forget to take a dose, take it as soon as you remember. If it's almost time for your next dose, skip the missed dose and take your next dose at the usual time. Do not take a double dose to make up for the missed one. You should store Ilevro Suspension, drops, final dose form, in the refrigerator or at room temperature, away from light, but do not freeze it. It's important to keep all medications away from children and pets. When it's expired or no longer needed, you should properly discard this product. You can consult your pharmacist or local waste disposal company for guidance on how to do this. And remember, never flush medications down the toilet or pour them into a drain unless instructed to do so. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.